The Universitas 21 Health Research Exchange, or U21HREx for short, is a virtual international knowledge translation and exchange network and community of practice for students and early career researchers in health and social care. It includes University of Maryland as lead institution, University of Birmingham in the United Kingdom, and the University College Dublin in Ireland. And we created this community to facilitate research and practice mentorship and professional development for students and early career researchers in the field. U21HREx provides the opportunity to expand on local and international research, practice, and joint academic initiatives to strengthen U21 member institution connections and train the next generation of healthcare leaders. In October of this year, we held our biannual in-person symposium at University College Dublin, where we discussed challenges and opportunities to improve health systems across nations.
Hello, I'm Julia Gowley, an assistant professor at the Center of Evidence Synthesis and Implementation Science at the University of Birmingham. I recently had the honor of joining an expert panel leading a workshop on skills development, career progress, and impact on policymaking at the U21 Health Research Exchange, hosted by the University College Dublin. It was a fantastic experience for three main reasons. First, the knowledge exchange. Hearing how healthcare systems and academia work across countries really made me reflect on new perspectives I can bring into my own work. Second, the connections. I met brilliant PhD students from Maryland, Birmingham, Dublin, and I've already linked some of them up to share ideas and collaborate. And third, the atmosphere. Spending 3 days with such passionate, driven people was incredibly inspiring. I'm excited to keep the momentum going and explore new ways we can work together. Thank you very much.
This is Khalil from the University of Maryland graduate program. So thinking about the Dublin trip really was inspiring to be in that space, to be validated and have some rejuvenating conversations, to feel inspired and to be reminded about the purpose of collaboration, both nationally, internationally. And when thinking about the impact of how this exchange can have on health research and policy, it helps to be reminded of what are the successes that are taking places, across the waters that can be implemented locally with a global perspective. And continuing that collaboration, I think, is going to be one of the best resources for us as an industry and as a community.
This is Delegate Ken Kerr. In the Maryland General Assembly, I serve on the Health and Government Operations Committee, where we hear all the bills and pass all the legislation related to health care in the state of Maryland. As a policymaker, attending the U21 Symposium in Dublin helped me to understand how the laws we make in Annapolis affect the lives of patients, caregivers, and public health workers across the state. And it also helped the public health officials understand the careful consideration that goes into shaping healthcare laws and the thoughtful monitoring we do to ensure the policy is working as intended.
Thank you so much, Megan, for having me here. It's an absolute pleasure to be here with you guys here. And for me, as an early career researcher, the U21 Symposium that we had at the University College Dublin was a really exciting opportunity that gave me the chance to take on a leadership role because I was facilitating one day's session, and I got to meet lots of people. We had people from the University of Maryland, University of Birmingham, and we had students and early career researchers, expert researchers from UCD as well. So it just opened up a lot of different universities' ideas, and it gave me opportunity to learn and collaborate and network. So that was really good for me.
My takeaways about the symposium, the biggest ones would be making connections, networking, and seeing how health policy research is very similar in spite of differences in health systems. I think a big takeaway would be the opportunity for exchange of ideas with early career researchers and getting a chance to present with different different people from different health research backgrounds is super exciting and super important. And I think that's one of those inspirational things that happen in these spaces. And I think that's super important for the future of health research and health policy.
My favorite part about the UCD sessions was collaborating with the international students and listening to their research. Talking about what issues were most apparent and comparing it to the United States health system. Then coming together to think about solutions or coming up with new areas to research into. Trying to create better policy and public health in general.
At the symposium, I really appreciated how each and every single PhD student was able to present their unique topic that they're studying and researching, and being able to hear different perspectives from a PhD student to a professor, and seeing how each university does things differently and how they're all interconnected in unique ways.
Hi, my name is Malachi Floyd. I am a master's student at the University of Maryland studying health administration, and we all had the opportunity to go to Dublin in October for the U21HREx Symposium, and it was just a great experience. I find it interesting to see that no matter if you're separated by sea or state lines, our problems are more similar than we think, and I feel like just seeing everybody's area of research, I just know it would be beneficial to keep collaborating and keep working together because, I believe there are power in numbers, and I think we can all achieve our goals together and with support and just helping each other out. So it was a great time, and I really appreciate the experience. And that is a wrap on our recap of the U21HREx Symposium that we held in Dublin this year. And it was just such a wonderful time. It was a beautiful campus. We met so many intelligent minds from different backgrounds, all working towards the same goal, whether that be early career researchers, master's students, PhD students. We're all just working so diligently and passionately to create the world that we want to see as far as healthcare goes. And there's a lot to accomplish. There's a lot that needs work and needs fixing. But when you're in a room and at these symposiums around these people with such passion, you just feel the synergy, and it's very contagious, and you stay motivated, and you just want to do more. And that's what this community is really all about. So this one was amazing. We hope that you are leaving here feeling inspired. And if you have any travel plans coming up in the near future, this spring, we are going to be in the UK at the University of Birmingham for our next in-person symposium. And we'd love to see you guys all there. And thank you for joining this one and seeing what we've done. And we have a lot more to accomplish, so stay tuned. And it was great sharing this with all of you guys. So thank you so much.